going to talk about the FIGO scoring system of the gestational trophoblastic disease. Now, this scoring system is important not only for exams but also for treating patients in the clinical practice. Now, the only thing I want you to remember in this scoring system is that there is no score of 3 in the scoring system. It starts from 0, 1, 2 and then directly 4. So this is the only thing that we have to remember in the FIGO scoring system, and rest I assure that the mnemonic will do. Now, first and foremost point that we could see is the age of the patient, and the score given is 1. Okay, so anybody who gets to a certain age will attain that age only once in their lifetime. So age has a score of 1 and that age is 40. So if you can see the mnemonic, this lady is celebrating her 40th birthday. So this mnemonic is about a birthday party of a lady who is celebrating her 40th birthday. So the score which is given to age is 1 because she will become 40 only once in her lifetime, and the age which is significant, the age with score 1 is the age 40 and above. Okay. So this is a very important point in the FIGO scoring system of gestational trophoblastic diseases. Now, next point that we have to talk about is the antecedent pregnancy. Now, if we see and look at this lady, we can see that she has got 1 and 2 kids. So she's got 2 births. Okay, that means the score given to births is 2. That is easy to remember. Now, by seeing this picture itself, we can understand that she's got 2 kids. So that means 2 births, and that means the score for birth is 2. Now you can see she is crying on her birthday and she has an ultrasound scan in her hand. She is not able to forget one abortion that she had in the past. So despite having a score of 2 for the birth, she is not happy because she had 1 abortion in the past. That means the score for abortion is 1. And if you can see, there is a mole, and mole is usually a circular one. So she has a circular mole. That means the score for a mole is a circle. That means 0. So mole 0, abortion 1 and births 2. So just by remembering this picture of a woman with a circular mole, 1 abortion which she is not able to forget, and 2 births, we can remember the score for the antecedent pregnancy. Now next we have interval months from end of index pregnancy to treatment. Okay. Now whenever we're talking about months, we have to think of a calendar. Okay. Now if you can see this calendar, I have specifically highlighted the 4th month, the 7th month and the new year, which you can say is the 13th month. To be talking about the 13th month, this is the best way we can say, because a year only has 12 months. Now, so you can imagine this hotel is taking bookings from the 4th month till April. They don't book for birthday parties. In April, they start their booking. The next booking they take is in July, the 7th month, and then the 3rd slot for booking is the New Year or the 13th month. So April, July and the New Year is the time when they take bookings for birthday party in their beautiful hotel. Now this will help us remember interval months. If you can see there is no booking till April, so 0 score for less than April or less than 4. April is the 4th month. So when you're talking about months, less than April up to 3, third month, they have no bookings. Their booking starts, that is the first score starts from April. Second score starts from, the second slot of bookings starts from the month of July, that is the 7th month. And the third slot or the score of 4 starts from the New Year, that is the 13th month and onwards. This is the easiest way to remember the interval months from the end of the index pregnancy to treatment. Okay. Next we have to talk about the pre-treatment beta HCG. Now we are talking about beta. In India, beta is for kids. And when kids go on a birthday party, they want to go for rides and they want to have fun. But here the charges are really high. You take your beta and you want to take them for rides, but when they go to purchase the vehicle for the ride, it is very, very expensive. They are being told that the hotel can give them a cycle which is one-wheeler cycle. They will sell it for 1000 rupees. If you want a two-wheeler bike, they will sell it for 10,000 rupees. So one more zero is added. And if you want a four-wheeler, you want a car or something, then one more zero is added, that is 1 lakh rupees. Okay, so one-wheeler cycle 1000, that is affordable. Two-wheeler bike 10,000, still affordable. But a four-wheeler will cost you 1 lakh rupees. Okay, now how is this relatable to our scoring system? Let's go. Now the beta FCG values for this one-wheeler, it starts from 1000 rupees. Two-wheeler 10,000. Four-wheeler 1 lakh. Simple and easy. Now next we are talking about the largest tumor size including the uterus. Okay. Now imagine the uterus was a marble. Okay. Now you can see this beautiful lady over here. She is in the birthday party. She knows when children they come, they will ask for marbles and pebbles. Now she knows that the betas, they were getting the rides at a very expensive rate. So she's kept the marbles at a very low cost. The uterus sized marbles for a very low cost. Okay. So up to 2 marbles, she's giving it for free. Up to 4 marbles, she's charging only 1 rupee. And for 5 or more marbles, she is wanting 2 rupees. So 0, 1, 2 rupees only. Even if you have a coin of 2 rupees, just one coin you have to bring, a coin of 2 rupees, and you can get 5 or more marbles. Anything. She will not charge you more than 2 rupees. Okay. So this is a very, very nice lady. She is charging only up to 2 rupees. So almost all the children can afford the marbles. Okay. Nothing more than 2 rupees. Even if you want more than 5 or 5, then you have to pay only 2 rupees. Now, how is this relevant for our scoring system? So we said the uterus or the tumor size, you have to think of it as a marble. Okay. Now I said For up to 2, that is less than 3 marbles, you have to pay nothing. Okay. Then from 3 onwards, you have to pay 1 rupee, that is a score of 1. And for 5 onwards, you have to pay rupees 2. And 2 is the maximum money that she will charge. Okay. 1 coin, either a 1 rupee coin or a 2 rupee coin, that is the maximum this lady is charging. Okay. And that too she is charging only for 3 marbles or 5 or more marbles. Okay. Less than 3 she will not charge, and more than 5 also she will charge only 2 rupees. Okay. So this is another easy way to remember the largest tumor size, including the uterus in centimeters, for the FIGO scoring system. Now we have to talk about the size of the metastasis. Okay. Now size is a very easy way to remember. We have a song for this. You can see this child, he has been given a very important responsibility. He will make us memorize the site of metastasis. Now this boy, he has a name, that is Leon. And Leon is a very fantastic singer, and he sings in Gujarati. Okay, so Leon, though he is Leon, that doesn't sound to be a Gujarati language, but he speaks Gujarati language beautifully. So with speaks we have spleen and kidney, Gujarati, that is gastrointestinal, and language beautifully, that is the liver and the brain. Okay. So Leon speaks Gujarati language beautifully. Leon is 0, speaks is 1, Gujarati is 2, and language beautifully is 4. Liver and brain is 4. Okay. Now there are 2 more points left. Number of metastasis and the previous failed chemotherapy. Okay. Now when we talk about the number of metastasis, you can see mets and guests. Okay. This sounds very alike. Okay. Now here what they have done is they will only allow a maximum of 2 guests at a time. Okay. And the charges are very high for the for the guests. Okay. So what are the charges? 14,000 for 1 guest, 58,000 for 2 guests. Okay. Now how does this help us memorize the mnemonic? Number of metastasis, that is the number of guests. Okay. So for 1 guest it is 14, and for 2 guests it is 58. Okay. And if you have more than 2 guests, okay, that is, if you have 4 or more guests, then the charges are high. Okay. That is, if the number of guests or the number of guests is high, then it is, if it is more than 2, then the score becomes really high. Okay. So for more than